and welcome to PodcastDX, the show that brings you interviews with people just like you, whose lives were forever changed by a medical diagnosis.
I'm Lita.
I'm Ron.
And I'm very tired.
Okay. Collectively, we're the hosts of PodcastDX.
Today we're talking about mental health care and what to look for in a mental health care provider. And now, before we talk with our guest, Michael, let's cover some of the basics.
Okay. Well, what exactly is a mental health care provider?
Well, in broad terms, mental health care providers fall into three main categories.
There are those who are trained to evaluate mental health care conditions and provide therapy, including therapists, counselors, clinicians, clinical social workers, and psychologists.
And then there are those whose training also allows them to prescribe medication, enabled to diagnose and provide therapy for mental health conditions. Examples of these providers may include nurse practitioners, primary care physicians, psychiatric pharmacists, and psychiatrists.
And then finally, there are those without a degree in a mental health care related field who may also be able to provide guidance and support. And included in this category are religious leaders, perhaps a rabbi or a priest or another religious type leader, peer counselors, and we've spoken to a peer counselor or two in our time, and similar individuals.
We can all benefit from talking with a mental health care provider at some point in our lives, and I'm thinking about like right now with the coronavirus and everybody locked inside, and this is a good time to talk about it.
Yeah, this has taken a toll on people, both physically if they do get it, emotionally because people are stuck at home, and also financially because a lot of people are out of work now. So this is a heightened point for people to talk to mental health care providers, absolutely. Let's look at 5 different signs that you can look for to be indicators of maybe saying that you need to find some mental health care treatment.
Okay.
One would be feeling sad or angry or otherwise not yourself. Uncontrollable sadness or anger or hopelessness may be signs of a mental health issue that can be improved with treatment. If you are eating or sleeping more or less than usual, withdrawing from your family or friends, or just not quite feeling yourself, talk to someone before some serious problems develop that could actually impact your quality of life. If these feelings escalate to the point that you question whether life is worth living, or if you have thoughts of death or suicide, please reach out for help right away. Another sign is if you are abusing drugs, alcohol, food, or sex to cope. When you turn outside yourself to a substance or behavior to help you feel better, your coping skills may need some fine-tuning. If you feel unable to control these behaviors or you can't stop despite negative consequences in your life, you may be struggling with addictive or compulsive behavior that requires treatment.
And can I throw in one other thing? Video games.
Oh, yeah, right. If you can't get off of the video game.
Right. I mean, there's people that play video games to the point where they're
soiling themselves.
Right. So
instead of getting up to use the washroom.
Yeah, so I'm going to throw video games in there too. Sorry.
I knew about the addictive behaviors with video games, but I never heard that one before, Lita.
Yeah. Yeah, they wear Depends or pull-ups or something and just keep pushing through.
Yeah.
But you're right, it is an addictive behavior. I mean, if you can't even go to the washroom because you're so focused on playing the game, that is definitely an addiction.
Right.
So,
definitely fall under that category. Another sign, and most people go through this in their life, when you lose someone or something that's important to you. Grief, it can be a long and a difficult process to endure without the support of an expert. While not everyone needs counseling during these times, there is no shame in needing a little bit of help to get through the loss of a loved one. A divorce, many people experience divorce, or a significant breakup, or right now, we're talking about the loss of a job with virus A lot of people are losing their jobs. So this can be very, very difficult. And if you have more than one of these happen at the same time, it's a disaster problem.
Sure.
Yeah.
And a lot of this is going on at the same time right now.
You're losing your job, your freedom.
There are people that are passing away that you can't even grieve for in a typical way at a wake.
Yep.
Yeah.
So this is, I would imagine that the amount of people going to see mental health experts right now will be spiking upward because of this virus. It has turned not only, our state, it's our country and the world upside down.
Mm-hmm.
Right.
So yeah, that is definitely something that people need to watch out for.
Right.
Another case is if you have something traumatic that happens in your life. You may have a history of abuse or neglect as a child, or some other significant trauma that you haven't fully dealt with, or if you find yourself a victim of a crime or an accident, or chronic illness, people that have different sicknesses that they have all the time, it might be better to talk to someone to help learn how to cope in healthier ways.
Right, and people that are stuck home with
abusers.
Right now. There's lots of resources out there, and we'll make sure we put those on our website.
Right. Telemedicine right now is the key word.
Right, but there is also safe places for people to go even now.
Okay, yeah. Right.
Absolutely. I agree with you completely. So the last one I wanted to touch on before we move forward was if you can't do the things that you like to do,
and that's not via quarantine. That's if you just don't have the drive within you, correct?
Oh, absolutely.
Okay.
I mean, right now everybody's pretty much under quarantine,
right.
So it's government basically telling us to stay inside for the most part.
Right.
But yeah, you're absolutely right. It's not having the drive or the desire to do stuff that you normally enjoy doing. If that's the case, please go see a mental health expert, because that could be a sign of some issues that you need to deal with.
Right. Well, thanks, Ron. And Jean, how do you know if you found the right person for your particular problem? Let's say you are willing to take that step and get help. How do you know if you found the right one?
Well, there are resources available. For example, the National Alliance for Mental Health. People have many different reasons and personal reasons for which they may consult a mental health care professional. And if you're looking for a mental health care professional, you want to make sure you're looking for someone who is licensed. If you need medication, you want to make sure that person can prescribe medication. Or if you're looking just to talk with someone, then you have a more broad field. If you're looking for a mental health care provider, I would say look for someone who you feel comfortable talking with whom you can be completely open. This is somebody you're going to want to talk to about your addictions, your very personal problems, and you want to make sure that you feel comfortable speaking with that individual. And I know I've had counselors in the past who are very judgy, and you can see it in their facial expressions and how they, react to you. And I wasn't comfortable with that person at all. So I switched to someone with whom I feel more comfortable and who is able to listen to me without judgment, and therefore I can express myself. You also want to make sure that they are certified or licensed in whatever field they are in. So if it is like a physician or a psychiatrist or psychologist, that they have their degree. If it's a peer-to-peer counselor, that they have adequate training. And there's lots of mental health care fields out there. And if you need assistance, we'll make sure we have some links on our website on how to find the right person for you.
Okay.
Insurance might come into play. So if you do need someone that accepts your insurance, you're going to want to seek them out as well. And in this day and age, you can definitely see a mental health care professional today on your phone, so or via computer. So if you do need to talk with someone, make sure you reach out.
Okay, good advice. So insurance and referrals, Ron, What do you know about that?
Well, if you do have health insurance, I would say please start by calling your insurer's information number. Ask for different phone numbers of professionals in your area that accept your insurance plan. That's key. Make sure that they're going to take your insurance, because you're not going to want to get a big bill down the road.
Right.
Get more than one. Try to get at least 3 different names and numbers. It's also a good time to ask for clarification of all your benefits. Some of the questions that you might think about asking are, can you make a direct appointment with a psychiatrist, or do you need to see a primary care doctor first for a referral?
Yeah, different plans are different.
Oh, absolutely. How does your plan cover visits to therapists? Sometimes therapy coverage can vary greatly between insurance plans. You may get one good for, 30 days or 60 days, or you may get one that allows you to go for X number of visits before you have to get another referral.
Okay.
If you need help with a specific condition, such as an addiction or maybe an eating disorder, ask for doctors with a subspecialty in those areas.
Right, rather than waste time and go to somebody that's not going to help you, and then you're using an appointment. If you're only given so many appointments, you're kind of wasting one then, right? If you don't have the specialty that you need.
Oh, absolutely. You definitely want to make sure with the insurance that you're getting the most bang for your buck.
Right. And what happens if you don't have insurance?
I'm glad you brought that up, because we find out a lot of people, unfortunately, don't have insurance. Their first stop should be at a community mental health center. And you can find those phone numbers either looking up online, or you can find them at the public library, and suggest calling them and kind of trying to find out what your next step would be. If you have health insurance, that's great. If you don't, seek out the community.
Right.
Seek out the community.
Or even, as Jean was saying earlier, a religious leader, because they are obviously trained in a lot of things.
But yeah, many
are. Right.
Many.
They have advanced. A lot of them have advanced
degrees, but they may not have. Well, yeah, many can provide counseling.
Right.
But yeah, check with your.
Right.
Yeah.
Right.
Okay, sorry.
Well, I guess what I would add to that is do all the research like we're talking about, but make sure you find somebody that you feel comfortable talking with.
Important.
Right.
Very
Yeah,
important. Right. And then that leaves just one last thing, and that's making the call. Although we're trying to remove the stigma from mental health care, if you find that you're reluctant to call, ask a friend, family member to call for you or call with you to make an appointment. If it's your first time seeking a diagnosis, tell the person on the phone so that they can block out enough time for a good conversation with you. If you're told that new patients have to wait many months for an appointment, it would be wise to make an appointment anyway, and then call the second and third numbers on your list so that you can cancel your first appointment if you find somebody that can help you sooner. Another way to get an appointment sooner is to join the waiting list for cancellations. If another person cancels at the last minute, you can get an appointment earlier than you expected. I'm sorry, were you going to say something, Ron?
No. I was just saying that was a really good point. Even though you make an appointment, call the other ones. Maybe you can get in sooner.
Right. I mean, you do that with well, I do that with concert tickets. I grab the first one I can get, and then I look for better seats.
And then it's everybody in that audience. Okay.
If you feel that you can't wait for months or weeks for help, see your primary care doctor as soon as possible to get treatment and support to tide you over until you have your team assembled. And if you're in an emergency situation, please go immediately to a hospital emergency room.
Wait. Or call 911, because now...
Okay. Yeah, times are changed now.
Yeah. During your appointment, make sure you ask lots of questions. Your first visit with your doctor or therapist, you're going to be seeking advice, but you also are trying to learn more about them and see if the two of you are a good fit. It's reasonable to ask questions, be honest about the fact that you're looking for someone you can work with long term. And here are some questions you might want to think about asking. Do you feel comfortable with this person? Even if this person has a good reputation or a high level of education, the most important thing is whether you can work well together. What vibe, do you get from that person? The personal questions a mental health care professional asks may make you uncomfortable sometimes, but the person shouldn't make you, feel uncomfortable. You should feel like you can be open and honest with that individual. And you should feel like that person is on your side. And I certainly have had a counselor who was not on my side, very judgmental, and would not even listen to me. So that was not fun. How much education and professional experience does this individual have? Is it adequate for what you need? Has this person worked with people with similar situations? And for how long have they done that? Are they new to the profession? How will you work together to establish goals and evaluate your progress? You might go in thinking, I don't know what this person could do for me, but they should have an idea and be able to explain to you how things will work. What can you expect if you work together? How often will you meet? And how hard will it be to get in for an appointment? Can you call on the phone or email between appointments? Are they available for that? And what kind of improvements can you expect to see in your condition? And if you do have a serious psychiatric condition, you probably want to, make sure that if they're not available, if they're on vacation or something, that they have someone that will be covering for them while they're away. If you're concerned about your ability to meet insurance copays or deductibles, bring it up and let them know that that's an issue or a concern that you have, and ask if you can pay on a sliding scale or at a discount. Doctors and therapists, they probably want to know ahead of time if there's an issue, and so that you guys can rectify it in advance and avoid any interruption in treatment. And then if you have a provider who understands and respects your cultural background, that can be extremely important. If they don't, if they have, a bias against your particular religion or background, that's going to interfere with treatment. And then once again, the NAMI website offers additional tips on how to find the right provider for you. And they're definitely a worthwhile resource to have.
Mm-hmm.
Yeah, that's great information, Jean. Thank you so much.
Mm-hmm.
Lastly, you want to build that relationship. Sometimes a person that you visit just doesn't feel right,
mm-hmm.
or they lack the experience with your particular mental health condition. It's okay to move on to the next phone number on your list. Just keep looking till you find somebody that you feel comfortable with. Remember, you're recruiting team members who can help you with your treatment on a long-term basis. With a little persistence, you'll find people who will listen to you, who will take your perspective into consideration and work with you to improve your sense of well-being.
Okay, well, now I guess we're going to go and talk with Michael and learn more about him and mental health care and the different types of mental health care.
All right. Here comes Michael. Michael has been helping change individual lives for over 20 years as a counselor, a coach, and a mentor. His passion is in helping veterans, first responders, and their families. He enjoys spending time with his wife and daughter, playing basketball and video games. Hello, Michael, and thank you for joining us today.
Hello. Thanks for having me.
No problem. Well, Michael, I'm going to start us off by asking what got you interested in helping others and what got you interested in mental health and the mental health community and the mental health field?
What really got me started was I have seen a lot of friends, especially veterans, come home and really suffer and struggle with just what they saw out there, just that whole process. And so when they got back, they didn't get the help they needed. And it was really frustrating because I've lost a lot of good friends, both when they come back, and then also obviously when they were in a wartime situation. And as I've gone into this field and looked at it further, there's a lot of like trauma and things that people struggle with that they just don't know how to deal with, or they take it home to their families, and then that kind of destroys their families. And because now they don't have that support anymore, it's everything in their life just starts to kind of domino and fall apart.
Sure, sure. Well, did you say that there were a lot of friends? I don't want to ask your age group or anything, but what era, what wartime era were your friends in? Was it like Gulf War or Vietnam War or?
Or
No,
current
most
action in Afghanistan and
Yeah, current.
the Gulf War.
Gulf
Okay.
War, okay. All right, because, it kind of depends on how they were treated when they got home.
Sure.
Gene and I are both veterans, and
Okay.
and we understand how things have changed over the years with veterans coming home and how they're accepted and how they're treated, and we appreciate that you're reaching out to them. That's wonderful. Michael, how has your experience with mental health influenced your career? You started out in marketing, correct?
That is correct. Yeah, and so I've always dealt with mental health on the side through a lot of different volunteer organizations,
Mm-hmm.
and it's one of those things. It was always a passion of mine, and as I kind of got older and marketing kind of I burned myself out of, just because it's like, hey, I can entice people to buy a bar rope with a slope on it. It's like, it's not a lot of value and not a lot of meaning at the end of the day.
Sure.
So
Sure.
yeah, I made great money and I worked long hours, but at the end of the day, I wasn't fulfilled in that. And so I decided to make a complete career switch and just do counseling full time and just help those people that I've been helping throughout the years and get them to where they want to be, help them find that best version of themselves, whatever that looks like.
Mm-hmm.
And the marketing, I mean, pretty much counseling a lot of times is in a way a brand. You know, I'm looking at an individual and going, okay, well, how do we improve that? How do I help you talk better, reach out better, get the support you need, all those things. So that's really like your brand. And so there's a lot of skills that I took from marketing and I'm using them in what I do. And I don't just, like, a lot of people think of mental health as, hey, oh, it's your addiction. Oh, hey, it's just this little problem. It's your mental illness. But it's really everything, because if you're right in the head and you feel comfortable, you feel confident up there, your body's going to feel better. You're going to want to get out of bed in the morning. You're going to want to take the dog for a walk or spend time with your kids or your family. And so it encompasses everything. So I don't just help people just with the mental aspect. I help them with getting a new job, changing that career, moving in all those little aspects, because if I can raise one thing, and then everything else gets raised as well.
The butterfly effect.
Well, yeah, and I think we've been talking
Yeah.
more and more about how mental health and your overall health is another key to that puzzle for
Right.
overall health.
Right.
and
There's so many
wellness.
different pieces, and if you have one piece that's a little bit bent or broken, it kind of takes the whole body down, and your goal is to try to raise it up just a little bit more.
Well, and Michael, I understand that you're also interested in helping first responders, in addition to helping members of the armed forces, and also healthcare workers. What makes those populations in particular of interest to you?
One is they all experience trauma in a lot of different ways, and they struggle when they go home. And that's a lot of what I do, is like a firefighter or a police officer. I mean, they see kind of the world at its worst. I mean, it's not peaches and cream and sunshine and rainbows every day on their job.
Sure.
And when they come home, a lot of times they don't know how to communicate to their family, to their loved ones, to those that support them, like what they need and how to move forward. And so what I do is I go in and I meet with the families to help them understand, hey, this is what they're going through. This is some ways to help talk to them and move in that direction, because it's usually not that they struggle with the job, it's that everything else is falling apart around them.
Okay.
Well, yeah, right. I could understand that. And then how, I wasn't thinking of asking this question, but how does a counselor keep that from internalizing? In other words, how do you keep from becoming depressed, I guess, yourself after dealing with all of this trauma on a daily basis?
Allowing myself to be there emotionally with them. And a lot of also what I do, and this goes into health, like the healthcare people that I help, is a lot of deprogramming in how things are done in healthcare. It's one of the things, like in healthcare, you'll hear that, oh, hey, you need to show empathy. That's great, but in order to show empathy, you have to be emotionally there.
Right.
And then they're like, well, you can't be emotionally attached to your patients. It's like, what do you want me to do? You want me to be there, but I can't.
Right. Yeah, I was just kind of curious.
Yeah, for them to learn how to walk that line. That's,
Right.
Yeah, challenging.
And I guess living in the moment and focusing on the moment, focusing on now, that might help.
And allowing yourself to feel in the moment. It's like if you're in a relationship with someone and all of a sudden they kind of cut off emotionally, you can feel that in the conversation. You're like, whoa, where'd you go?
Okay, right.
Yeah.
I mean, we've had that experience. I mean, probably on both sides in a relationship where we're like, you know what, I'm done, I'm checking out, and the other person has too. But if you allow yourself to feel and be there with that individual and acknowledge that, I mean, I hear horrible things on a daily basis of what some of these individuals have gone through or seen. And yeah, it feels bad when I hear it.
Right.
I let myself feel that, and then I'm able to move on with it.
Okay. I actually donated a kidney to a firefighter downstate, and when I was talking to him a while back, he was telling me about the fact that he had gone to a couple of different. He had seen some very terrible things, including like suicide and terrible accidents. And I said, how do you deal with that trauma? How do you deal with that stress? How do you just come down from that? And he said, you just do. And I think there's a lot of men that just don't really accept the fact that they might need a little bit of extra assistance in the mental health arena. What do you think about that?
I would agree. I mean, as men, we're kind of taught to rub dirt on it, kind of get up and keep going. And the whole expectation of men is so different nowadays of what we should do, how we should act, and everything. And the fact of the matter is, men are just as emotional as women.
Right.
And we need to experience that. And the more we cut that off, the worse our lives become.
I agree. So that leads me into my actual question. So when should someone see a counselor? How do they know that it's time to see a counselor?
I mean, anytime someone experiences any kind of like a life change, so if you've changed jobs recently, if you have broken up in a relationship, gone through divorce, had a death in the family, all these things are good times to kind of reevaluate your life. I mean, also it's like if you find yourself sitting at home going, oh, how do I move forward from this? Like what's my next step, and not really figuring, not knowing or feeling lost. That's another time. if you're listening to this podcast going, well, when should I go see a counselor or a coach or someone? Call.
Right. So in other words, if you have the question, then that's the answer for you, that it's time.
Yeah.
Okay. Exactly.
And there are different avenues that you could go to then. You mentioned coaching.
Yeah, and so there's a variety of different help you can get out there, and the biggest thing I tell people is people that you trust, ask them and say, hey, have you ever gone to see a counselor or someone to get additional help? And you might be surprised that there's actually quite a few people that have gone for help, and then they can refer it. Also, I mean, you can look it up online. You can look. There's a lot of ways to look it up, but the biggest thing is you want to feel comfortable with that individual. And if you go there and you're like, wow, that just felt weird, I don't know if I can trust that individual or open up to them, then don't go back. I mean, there's a lot of other counselors there that can definitely help.
Okay.
Right. Yeah, we were actually talking about how sometimes the first step might be to utilize telemedicine or something of that nature to kind of just like lead into it, so you feel comfortable. So you're actually talking to someone while still at home, and then they can refer you to someone in your area, which is kind of nice.
Mm-hmm.
But just having technology is amazing, and how it's really expanded how we can seek out care and receive care and treatment, and how that can come into play.
Sure. And how can counseling help us? What does it do for us?
A lot of it will give you a different perspective, and so, or in kind of a lot of times we know what the problem is inside of us. Mm-hmm. I mean, when we're really honest with ourselves, we're like, hey, I won't be over there, but I'm over here now. So how do I get there? And we don't necessarily see the steps on how to get there.
Okay.
And so counseling can help give you those steps by the counselor listening to you and then using your skills, your strengths, your abilities to kind of map that out for you.
Okay.
And probably the most important part too is accountability. Is I hold a lot of people accountable. And so then they're like, oh, okay, I got to make sure to do that because I'm going to meet with him again on Thursday. So, and it's just having that accountability aspect.
Right. So it's not just just a goal. It's a goal that has something that
benchmarks.
A benchmark that you have to meet. Okay. Sure.
And Michael, what should we look for when we're trying to find a counselor? I know you were saying that you want to make sure that your counselor is someone that
you trust
and that you feel comfortable with. What other characteristics should we look for in a good counselor?
Other things. So how I do things is I have people call me the first time. So it's usually just a quick 15 to 30 minutes, and I just talk to them and say, okay, what are you trying to do? Like what's going on in your life? I try to learn a little bit about them because there are some people which I'm not going to be able to work with. I mean, I've got a lot of skills, but I'm not perfect, and I'm not going to be able to get everyone to where they want to. Mm-hmm. And so that gives me an opportunity to kind of hear a little bit from them, ask some kind of key questions, and say, oh yes, I can definitely help you with that. And then at that point, we set a time and we kind of move forward in that direction. So I don't charge for any of those sessions either, because to me, I'm not going to waste people's time or money just to say, oh, hey, at the end of the day, I really can't help you. It's like, no, I want to make sure that you're getting the best help you can. And at that point, after that conversation, if I can't help them, I've got a bunch of people that I work with that may be able to help them. Mm-hmm. And so I can give them a good referral at that point to somebody else.
Okay.
So, I mean, also when you're talking to your counselor, one, you should be doing most of the conversation.
Mm-hmm.
If you find that you know more about your counselor than the counselor knows about you, that's a problem.
Okay. So the counselor's not the one that's going to be talking. You're the one that's going to be talking.
That is correct.
Okay.
And it's because they're going to be asking those questions, getting you to open up. And I mean, they may relate things like my patients know that I'm married,
Mm-hmm.
that I love what I do. I mean, and that and generally how long I've been doing it. But at the end of the day, they really don't know much about me.
Mm-hmm.
But I'm able to connect with them emotionally because I can relate to their experiences. I can say, oh yeah, hey, I've gone through something similar, and it was difficult for me. But I never go into details or anything like that
Mm-hmm.
because I'm not the one in counseling. I'm trying to help them, not them help me.
Sure.
Mm-hmm. Right.
Well, and Michael, what tips do you have for someone, or tips, hints, or helpful advice do you have for someone as they're out there looking to find a counselor?
Calling up several different counselors.
Okay.
They'll be willing to call you back. Yeah, I mean, there's a lot of counselors on social media and out there that you can check out reviews, some of which are good and bad. But the biggest thing is reaching out. And another tip is if you see a friend struggling,
Mm-hmm.
maybe grab them and just say, hey, you know what? Let's call someone and just get their feedback on it. I do that a lot with my friends. It's if I see them struggling, I'm like, hey, let's go get someone a call. Let's just see what they have to say about it.
Sure.
Mm-hmm.
And doing that can help because I think a lot of times we get scared. Oh, hey, we're gonna go there, and now we're gonna have to spend the rest of the next 2 years or the rest of my life in counseling because I'm really messed up. That's not the case. A good counselor he's gonna help you lay out a plan on what you want to change, and once that change is accomplished, if you want to continue counseling, you can at that point. But I have a lot of people that I've worked with for a month, for 6 months, for a year, and we're done.
Mm-hmm.
And then they just check in every year with me, and they're like, "Hey, I'm doing great." So when you're talking to a counselor, they should be able to give you a good idea, not necessarily on the time, but the goal. Like, hey, you want to accomplish this? Okay, these are some of the things I'm gonna ask of you to do. And so they're going to be very specific. And if you're not willing to do that, it's going to let you know, okay, hey, you're going to need to look inward and see what I need to change. Or you're like, oh, hey, okay, I got some clear direction. I know what I need to do at this point.
So it's good to have somebody in your corner.
Right. Well, and I guess that's the whole point of having the counselor is that they are going to direct things and help you. Yeah. Like you were saying earlier, they're going to help you find that roadmap to your goal, which is great.
Yeah. And hold you accountable. And it's going to be someone that is not your mom or your dad or your brother or sister or a friend, that is going to be a little bit more objective when they look at it.
Mm-hmm.
And yeah, he's also going to be in your corner going, hey, I mean, I cheer a lot of patients on, like, hey, you're doing it. And it's steps. Change is never easy. But if we do a little bit each day, we eventually get there. It's like the journey of 1,000 miles starts with that first step. It's
Right,
like,
right, right.
Well, Michael, thank you ever so much for joining our show today. How can our listeners learn more about you and the work that you're doing?
So the best way to get a hold of me is either through phone or through email.
Okay.
I work. My phone number it's 949-322-6874, and
Okay.
my email it's mkendall, so MKENDALL at MYTAW, so it's MYWTA taboo.com.
Okay.
And you practice in the Phoenix area, correct?
I do. I practice in the Phoenix area, but I also work all over the world.
Okay.
So I have patients that I do phone and video chat through that are in Australia, that are in England, that are in Kentucky or North Carolina.
Okay.
And so I don't. If you need help,
It's
let me know.
It's a global reach. That's wonderful.
Yeah. And that's the nice thing about technology nowadays is that we can reach these individuals.
Right,
and,
right.
I mean, currently I actually have more people outside of Arizona than I do inside of Arizona that I'm helping.
Okay.
So
that's great. Well, thank you very much for joining our show today. We really appreciate the input. Yeah. We're trying to raise awareness for mental health, and I think that you've accomplished that very well. If our listeners have any questions or comments related to today's show, they can contact us at PodcastDX@yahoo.com, through our website, PodcastDX.com, on Facebook, Twitter, Pinterest, or Instagram.
And if you have a moment to spare, please give us a review wherever you get your podcast. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice or diagnosis or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. And never disregard professional medical advice or delay in seeking it because of something you've heard on this podcast.
Till next week.